Hi everyone, welcome to our online class. In the previous class, we discussed the healthcare system in India. Today, we are moving to the next topic of our second chapter, public and private healthcare services. We can divide various healthcare facilities into two categories. One is public healthcare and another one is private healthcare facilities. As you all know that in your village and everywhere in our country, we can see different types of hospitals, mainly two type of hospitals and healthcare centers we can see in our country. One is public healthcare facilities and another one is private healthcare facilities. Dear children, have you ever think that why pay taxes to the government? You know that we all are paying taxes to our government. Our government uses tax money for providing many public services for the benefit of all citizens, such as healthcare facilities, road and transport facilities, etc. Dear children, today we are going to discuss the first category of healthcare services, public health services. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas. Public healthcare service means it's a chain of health centers and hospitals run by the government. These healthcare services are covering both rural and urban areas. Now let's discuss the public healthcare system in our country. You can see a diagram in the screen. The top of the diagram, the medical colleges. That is the highest medical facilities or public healthcare facilities providing by the government for the people. Then next category is district hospitals. You know that every district have a district hospital. The next, primary health centers, PHCs. Every village having a primary health centers. Last category or in the rural health centers. Every villages or each and every part of the village we have health centers. This is the public healthcare system in our country. Next, let's see some features of public healthcare facilities. Public means a service that is meant for all people in the country and is organized by the government. So, the public healthcare facilities are provided by the government for all the people. It is only for welfare purpose. The public healthcare system which is running by the government, they are doing it is only for welfare purpose, not for the profit. And public healthcare system or public healthcare centers are providing health services either free or at a low cost. You all know that compared to other private hospitals, the public hospitals or the government hospitals providing their services either free or at a low cost. At last, the public healthcare services having a well-defined structure to cover both rural and urban areas. Because of that, the people in the rural areas also getting the public government hospitals services. Now you may have some doubt why the government is providing public healthcare facilities for the people. The reason is that according to our constitution, It is a primary duty of the government to ensure the welfare of the people and provide healthcare facility to all. The government must safeguard the right to life of every person. That is the reason the government is providing free healthcare facilities to all its citizens. That is the responsibility of the government. Article 21 of Indian Constitution ensure that right to life to all citizens. Hence, it is a duty of the government to provide medical facility to its citizens. Article 47 of the Indian Constitution provide for the implement of public health as one of the primary duty of the states. These two articles of Indian Constitution protecting the life of the people in our country. Dear children, today we discussed what is the two categories of healthcare services, that is public and private, and we saw that what is public healthcare facilities and what are the features of public healthcare facilities. Thank you. Have a good day.